Hi guys, welcome to the night shift. Thanks for joining me. So tonight and for the next 3 nights I'm going to be the orthopaedic registrar on call, and I'm going to have an orthopaedic SHO with me, and we're going to be responsible for all the admissions coming into the orthopaedic department overnight. That includes from other hospitals, emergency department of this hospital, making sure that the orthopaedic wards are fine, and also that we provide service to all the other wards as well. So hopefully it'll all go well. I'm going to just go into handover now to find out from the data registrar about all the patients, and then I'll catch up with you after. Hi guys, so our handover was at 8 o'clock. It's now about 8:50. The day registrar's told us about all the patients that came to the department during the daytime as admissions. We've got a few jobs to do for those patients, as well as a few patients that we need to see from fresh as well. Thankfully my SHO with me on the night shift is very experienced, so that's going to make my life a lot easier tonight. And we're going to crack on and see those patients now, so I'll catch up with you a bit later when we get a moment. Hi guys, so it's about 11 o'clock now, and I've just stopped to catch some breath. We've seen a few patients so far. The first one was this chap over here, who's a 65-year-old chap, stepped over a paving slab and sustained this injury. You can see this disruption to Shenton's line on the left-hand side, and so this is clearly a neck femur fracture. So we've seen him, we've consented him, we've had a chat to him, we're getting him ready for an operation tomorrow. The next patient I saw was this 11-year-old girl over here who twisted her ankle. So thankfully her x-ray is normal, and examining her as well, she's got a little swelling and it's most likely a soft tissue injury. So we've let her go home with advice to give her some pain relief, to keep the leg elevated to reduce swelling, and then she can walk on it as able, but it may take a few weeks really to get better. So thankfully there's no serious injury over there. And finally, the third case we've seen so far has been this lady who had a right middle finger dog bite injury. With these patients, you can see there's no bony injury on the x-ray, which is good news, but with dog bites, dogs have quite nasty bugs on their teeth, and actually even innocuous looking injuries can cause infection. Oh, there's a beep that's just gone off. Hopefully it's nothing for us to attend to.
Trauma alert ED, resus ETA 5 minutes. Trauma alert ED, resus ETA 5 minutes. Trauma alert resus ETA 5 minutes.
Okay, so with her, she may need to have an operation actually, so we're going to bring her back after giving her antibiotics, tetanus prophylaxis, and dressing her finger and giving her a good washout of her finger under ring block. So we numb the finger, give it a good washout in the emergency department, but actually these patients need exploration and a good debridement and a washout to reduce their risk of infection, because the hand has got lots of little nooks and crannies that can become infected, even with supposedly small or innocuous looking injuries. So that's just the trauma bleep that's gone on. So that means there's a potentially sick patient coming into the resuscitation area of the emergency department, which I'll need to go and attend, as they may have been involved in the high energy injury. So I'll go and see what that is and keep you up to date with that. Hi guys, so it's about 2 o'clock in the morning now, and I'm just wandering back up to the orthopaedic ward. So I attended that trauma call, and it was a young chap who'd been stabbed 5 times, unfortunately, sustaining stab wounds to his left arm, his lower leg, and also his back. So thankfully they weren't that deep. So we've got a scan which shows that no serious injury was done, and we have put some local anaesthetic in, given it a good wash, and stitched it back up. So he's got good treatment. He's on his way home now. Unfortunately, there was another trauma call that came as well in the meantime, and that was a more serious injury. So this was a young lady who was involved in a car accident. She's got severe injuries to her head, so she has what we call pneumocephalus, so air in the cranial cavity. She's got a small bleed in her head. She's got multiple facial fractures as well. She's also got a right wrist fracture, which is shown over here, which we've put in a cast. And she'll need an operation on that at some point, but that's certainly not urgent for the time being. So she's going to have all her other injuries dealt with by their respective specialties, such as neurosurgery and maxillofacial surgery, and then we'll get to her when we can in terms of an operation. I'm just walking to see another patient now, and I'll catch up with you after then. Hi guys, it's about 5 o'clock now, and I've just come up from seeing that last patient. It actually turned out to be a really, really interesting story. So he's a middle-aged man who's sustained a nasty right open intra-articular distal humerus fracture. We've seen him, consented him, he's going to need an operation with plates and screws to get that fixed. Thankfully things have quietened down a little bit now, so I've just come to the quiet corner of the hospital to try and get a bit of rest before the trauma meeting in the morning, which is at 7:30. So hopefully my bleep will be quiet and I won't get disturbed again till then. Hi guys, it's about 8:15 in the morning now. So my bleep did go off at 6:30 in the morning. I was called to see a patient who was a middle-aged lady who fell off a chair in a house, sustaining a right-sided closed comminuted tibial plateau fracture shown over here. So we've got a CT for her, put her in a cast, and she's going to need an operation as well. Thankfully I was just managed to see her in time just before the trauma meeting at 7:30. I'm sorry I couldn't take you in there for confidentiality reasons, but that took about half an hour to 40 minutes. Went through all the patients, all the scans with the day team and the consultant, and it's going to be up to them now to take those plans forward and operate on the patients who need an operation. So I'm pretty tired. I've just got back in my car and I'm just about to drive home to get some rest and do it all over again tonight. So thanks a lot for joining me, and I'll catch up with you a bit later. Hi guys, so fast forward a couple of days and I'm coming home at the end of my third and final night shift, and I just thought I'd keep you up to date with some of the cases that came in on our first night shift. So if you remember, we had that hip fracture on the left hand side, and as you can see over here, he's had what we call a long cephalomedullary nail. Interestingly, for his fracture, all he really needed was a short cephalomedullary nail, so a nail that doesn't span the whole femur. But the reason we've done this is because he's a chap who's at risk of falling due to his alcohol intake. And therefore, interesting thing about orthopedics is we've modified what we're doing, not only based on the fracture patterns, but also on the patient factors. Moving on to our next case, there's that nasty intra-articular distal humeral fracture. As you can see over here, he's had a significant operation, but achieved a really good operative result with plates and screws. And finally, there was that third case with the tibial plateau fracture, as you can see over here as well. She's received plate and screws as well to fix that and restore the joint line as well. So overall, a really, really good result. There's still some patients who require operations who came in on our night shift, and they'll happen a bit later on. Thanks a lot for joining me on these night shift. I hope you found it useful and given you an insight into the role of an orthopaedic registrar. And if you have any further suggestions or comments, then please feel free to comment below on this video or get in contact with me. I'm going to go to sleep now, guys, because I'm pretty tired. So take care. Bye.